staff burnout, junior doctor suicides. There's a huge amount of stress, losing good people from the system who've had many, many, many years of training, a lot of money spent on their training, a lot of effort gone into it. And there are people just walking away and saying, this is too hard. This is not good for me or my family, and I can't keep doing this sort of work anymore. So one of the things I started to do was collect stories from both patients and families and healthcare professionals.
Yep.
And here comes the arts getting back into the scene again. I connected with Alan Hopgood, who's a playwright, and I asked Alan if he could write me a play that might highlight some of these concerning issues about the culture, communication, patient safety, patient and family-centred care. And then we could perform this play in hospitals as an awareness-raising
You're
tool.
amazing.
Anyway, so I sent Alan all of these stories, and he came up with a fantastic half-an-hour play, which we've now done over 140 times in hospitals, at conferences. And the play basically is the story of an unfolding medication error. So a young lady comes into hospital with her mum. She's vomiting. They put up a drip. The junior doctor writes the wrong dose of medication in that drip. The nurses query her. The junior doctor doesn't want to be shown up in front of everybody. She's been bullied by the senior consultant for so long, she doesn't want to look like an idiot. So instead of drawing a line in the sand and saying, okay, we have to check what's going on here, goes through to the keeper and the young lady dies. Then we decided not to let people off the hook emotionally by letting her survive. We thought, we need this
powerful.
to be compelling. We need this to really shake up the audience.
And be realistic.
That's right. And it is actually based on a de-identified but a true story.
Yep.
And then the hospital executive bring everybody together to try and work out, how did this all go so badly wrong? The audience is quite aware of it, though. They've seen the intricacies of the conversations and the poor communication. And then we spend the next half hour, 45 minutes with the audience involved in the discussion about what happened, what went wrong. Have you had similar experiences? And we have the feedback now from 8,500 people all across Australia, which is a huge amount of data backing up that this is something that everybody is concerned about, but we haven't spoken publicly about until recent times.
Yeah, and I think that there's a fear to, like you said, and like the play highlights, it's a fear to speak up because, it's that fine line between speaking up and saving someone's life and speaking up and possibly ruining your own career path.
Correct.
So
yes.
It's like my life or their life. And so, I can see it's a hard position. But if the culture felt like it was a safe place to be seen, to be heard, to be listened to in a way that wasn't going to be criticised or judged or classified under a label,
exactly,
then there'd be more opportunities to, I imagine, to speak up and for change to take place.
Yes. So we've had some amazing audience discussions. We can tell the culture of an organisation pretty well by what happens after these plays.
Yeah.
So some places, administrators have stood up and said, well, it's a good play, but that older consultant character doesn't really exist. Followed by junior doctors who'll say, well, in fact, they're right throughout this organisation. They hold your career in their hands and there's no one safe, you can tell, because you won't have a job next year. And that really sets the room alight in discussing, okay, so what are we as an organisation going to do about this if that's what's really going on? We've had other places where the junior doctors will say, we're so well supported here. We really feel like we can go to anybody and ask for help. We've got great help from the nurses, etc. That is a healthy culture and that is great.
So because you've had a variety of feedback, and like you said, you look at the feedback that's negative and go, well, what are we going to do about it? Mm-hmm. I suppose I've got two little questions that come up here, probably quite big questions. One is, well, what are is there anything being done about it? Is there follow-up? I mean, this play sounds brilliant, and it's creating awareness, and the awareness is leading to discussions, which is brilliant, because that's probably the first opportunity that a lot of them have had to discuss it in a group environment. So the conversations are coming up. Has it been one taken to the next level where there's action? And I'm just going to mention the other part of the question because you might be able to intertwine it, is what about the organisations that are doing a great job? Is there any forum for communication and reflection between the ones that say they are and the ones that say they aren't to help each other?
Very good questions. So the first part of it, yes, we have organisations. What we do with all of that feedback is we theme it all and send it back to them in a report. And a few places we've then gone back in and consulted with them, and they've looked at their report and they've gone, oh, we've got quite a problem in this particular area. Have you got some suggestions about how we could move on it? Or they'll tell us, yep, they've already started. And that is really fantastic. The ones that are possibly not quite up to that stage can feel a little bit, we've just got all this bad feedback, how are we going to go forward? And then there are some that will actually try and deny that's a problem. So there are lots of different stages, but I think more and more organisations are coming up to speed with our culture is a really important thing to be working on, and the well-being and the joy in work for our staff is a critical piece now that needs to be dealt with. Yeah. So I'm really optimistic. I think that there's been such a big shift in the last 5 or 6 years. Still a way to go, but definitely people are recognising this and knowing that they need to have a safe culture. They need to have a safe place where people can let their seniors know if there's a problem.
Yeah. And I think that, when we look at wellbeing and wellbeing for staff within hospitals, I think that there's, two main areas, and one is the physical wellbeing and one is the emotional or mental wellbeing. And I think that I know that I have I've got quite a extensive background in the corporate wellness area, and that includes places like hospitals. And I know that, say, for example, the public, like the Alfred Hospital in Melbourne, I know that for many years they've had an on-site fitness facility and kind of like health program, but it's really probably tackled almost like a bit of an employee benefit to keep the staff on and, keep them, I suppose, physically well in some, which is really important.
Really important.
Right? But it's optional physically well. But where I'm seeing and hearing from what you're saying is that the area of the emotional well-being and the mental well-being, which I suppose culture comes under, is maybe improving but hasn't really been done so well. Is there challenges, like great challenges within a healthcare system to tackle that area?
I think there are quite a few challenges. It can be threatening, I think, to people higher up the food chain or the hierarchy to think that how you treat the people below you has got to change.
Yep.
I think that can be a hard thing to face. Something that one of the slumps that I went through in my journey is that I did start to get a bit overwhelmed by this culture piece and thinking, oh my goodness, there's so much bullying and harassment in healthcare and there's so much unhappiness in the health workforce. We're never going to get to the bottom of it. And the responses of some of the colleges and the AMA and things have been to write some more policies about bullying and harassment, and we at most hospitals now have an e-learning package on bullying and harassment. To me, it was all a relentlessly downhill, sort of a negative way to approach it.
Yep.
I got together with some colleagues back in 2016 and thought, what if we were instead to flip the conversation, not one about bullying and harassment and how we're going to deal with it, but what about a kind health system and how we can all work together to get to that spot?
Yeah.
And suddenly you can feel energy in doing that, and you can feel optimism that hey, we can all design a kind health system. How would we like it to be?
Yeah.
Well, it wouldn't be one that had all the bullying and harassment in it, because then it wouldn't be kind. So you can acknowledge that the bad things are still happening, but they are going to drop away.
Yeah.
When you promote it's aspirational, you're promoting the things that you want to see more of.
Oh, totally. And that, feeds really well into, a foundation that you've developed, which is the Gathering of Kindness Foundation or movement that is coming. So I'd love to hear, that, just continue what you've just said about, focusing on this, I suppose, wellness rather than what's going wrong. So the how do you not just look at, all right, so this is going wrong, so let's put some procedures into place for bullying and all those things, rather look at, all right, well, what can we do to prevent those things happening?
Exactly. This has been a very empowering sort of a movement. It started small, and it was really the way you were talking about your movement, that we got 100 people together from all different walks of life and different expertise into a room to do a great big, like a masterminding of what would a kind health system be like.
Yeah.
Are we just, talking rubbish here? Is there no point even trying? But there was this huge energy and appetite for more discussions on kindness, and how you suddenly then feel that you can do something.
Yeah.
If you're in a bad culture, you can just feel, I'm out of my depth. There's nothing that I can do. But what we came up with was that every single individual can take some responsibility and can perform small acts of kindness wherever they are in the hierarchy. It doesn't matter.
Yeah, and that's for general life for everybody as well.
Everybody.
That's
right.
No one is too small. I would not really like the word to say small, but too or insignificant or anything like that.
Yes.
But nobody is in a position where they cannot contribute.
That's right.
On some type of level with something like kindness. And yes, it might not bring about full global change of this massive project, but it can allow you to do something and take some self-responsibility and put the power back into your own ability and your own self.
That's right. Much more positive position to be in. And everybody knows stories of people, family members who've been in hospital and who said, the cleaning lady was just so kind. Every time she came in, she knew who I was. She'd ask how I was going. She'd bring my, water closer to the bed so I could actually reach it. Somebody in the system showing acts of kindness like that can be as significant as the medication that you're being given.
Oh, totally. And it's like and you see this a lot in the digital world. There's a huge growing area on user experience, but that's actually can be modelled in real life with every single environment, and it's looking at the user experience and all the interactions in the communication, in the way that the room's set up, in the music, in the all the different interactions, and every time all the senses are put into play, a part of the user experience. So how do they feel, and what do they hear, and what are they tasting, and what are they smelling, and all of the different senses can come into play for the user experience. And you don't need to have a medical degree to be able to contribute to the user experience or the patient experience in the hospital.
That's right.
Or system, or even the experience of the theatre staff, or the experience of the admin person, or the parents, or everybody's experience. And it's amazing, and it is so simple in so many ways to just do a small act of kindness and think that it actually can have major value.
Oh yeah, it's contagious. It's like a virus. So they can actually see on an MRI. And we had a neuropsychologist at our very first Gathering of Kindness, and he talked about MRI pictures. I do something kind to you, it lights up my brain and your brain. You're more likely to go on and do something kind to the next person you bump into.
Oh, that's brilliant.
It's brilliant.
That is brilliant, because I was actually about to ask you whether you felt